Well, Happy New Year, everyone. Hello, and welcome to the Housing and Services Resource Center's webinar, Braiding Resources to Collaboratively Develop and Strengthen Housing and Services Partnerships. Our goal is to create a robust dialogue for you to discover new opportunities, and we need to hear from you. So we have also built in a variety of opportunities for you to be an active participant in today's session. Thank you so much for joining us. Next slide. My name is Lori Gerhardt, and I'm the director of the Office of I'm the director of the Office of Interagency Innovations at the Administration for Community Living. We're an operating division within the U.S. Department of Health and Human Services. This webinar is hosted by the Housing and Services Resource Center. I will be serving as a facilitator for today's webinar, and it's a privilege to have so many of you here with us today. Your active involvement in this webinar is essential so that we have an engaging conversation and discussion. Next slide. Today, you will discover how the U.S. Department of Health and Human Services and the U.S. Department of Housing and Urban Development are setting a meaningful example for partnership. You'll learn how a state is braiding financial and programmatic resources in the creation of dynamic housing and health partnerships. And you'll hear some best practices for developing partnerships and solutions to challenges that sometimes we encounter as we develop these partnerships. You'll also hear about you also will develop an understanding of the resources that can be used to strengthen housing and health services partnerships over time, particularly access to technical assistance resources on recruiting and retaining landlords. Next slide. First, we'd like to share a few housekeeping items with you. This meeting is being recorded. By staying to participate, you're consenting to the recording. Also, all attendees have been muted for audio quality. One hallmark of our webinars is active participation from attendees. Please frequently use the chat to make comments and submit your questions anytime in the Q&A feature in the Zoom dashboard. Or you may email a question or comment to hsrc@acl.hhs.gov. We reserve time to address your questions later in the session. You can also use the chat or email if you have a technical issue or comment for other attendees. Next slide. Our goal is to support you in developing housing and service partnerships that effectively identify and coordinate rental assistance resources and services to support independent community living for people in need of stable housing. We'd like to conduct a short poll. Does your state or local community have partnership between community living support service providers and rental housing assistance providers? And so if we can put up the poll, the possible responses are yes, no, and unsure. And if you take a few minutes to respond to that poll, that'd be great. If you do answer yes, can you please place in the chat your state, local community, and can you provide any additional details about that partnership? Your responses will help us learn more about the partnerships already in place across community living support service providers and rental housing assistance providers. While you're responding to the poll, if we could go to the next slide, I'd like to tell you about the Housing and Services Resource Center, HSRC, which is a partnership between the U.S. Department of Health and Human Services and the U.S. Department of Housing and Urban Development. In every state and community, there are a number of entities and programs helping people access housing and supportive services, but the housing and service systems often are siloed. We're working together to create stronger collaborations between these systems so that more older adults, people with disabilities, and people experiencing homelessness can achieve housing stability, live with dignity and independence in their community, and avoid homelessness and costly institutional care. I'm proud to say that the federal agencies and the Housing and Services Resource Center all strive to model this cross-sector collaboration at the national level, which you'll hear more about in a minute. After the webinar, we hope you will look at the HSRC website at acl.gov/housing and services, all spelled out, at the end of the webinar. We'll share an email address too, so you can be in touch with us and get periodic updates. Next slide. And please close the poll. Wow, so it looks like 41% of you do have or know about a state or local community partnership between community living support service providers and rental housing assistance providers. That's great. And we're looking forward to learn more about those partnerships. It looks like 48% of you are unsure and 11% aren't aware of any. So thanks so much for responding to this poll. Your responses are really helpful to us. Now we'll move on to the next slide. We are going to start our webinar today with two very special guests. First, we have Ms. Melissa Harris, Deputy Director of the Disabled and Elderly Health Programs Group with the Centers for Medicare and Medicaid Services, or CMS. And we also have Dr. Richard Cho, Senior Advisor for Housing and Services in the Office of the Secretary at the U.S. Department of Housing and Urban Development, or HUD. Partnerships across disability, aging, health, and housing programs and entities are the key to best supporting the people we serve. As you know, our topic for today's webinar is focused on braiding resources to develop and strengthen partnerships between housing programs and community support service agencies. Dr. Cho and Ms. Harris exemplify the type of partnership and cooperation that studies show provide the best wraparound support. Dr. Cho is going to tell us a little bit about the origins of that partnership, and Ms. Harris will talk about those partnerships and how they've been used to develop comprehensive programs and pathways to services. I'll hand the presentation over to Ms. Melissa Harris and Dr. Richard Cho.
Thank you, Laurie, and I'm really happy to be here with you today representing CMS. We have acknowledged for some time the important links between access to affordable and accessible housing, health coverage, and health outcomes, including for Medicaid beneficiaries receiving home and community-based services, or HCBS. Linking housing and health can improve coverage, access, and health equity for Medicaid beneficiaries. We are continuing to partner with states to find pathways under the Medicaid program to integrate services and supports that can assist Medicaid beneficiaries with obtaining and maintaining housing. In 2021, CMS released a state health official letter that described opportunities to cover housing-related supports under the Medicaid program. And those could be covered under state plan benefits, HCBS waiver programs, managed care delivery systems, and Section 1115 demonstrations. A couple of things to note. Medicaid typically does not cover room and board. We are statutorily prohibited in doing so, except in medical institutions, unless we have conveyed special authority to a state under a Section 1115 demonstration. Excuse me. Housing-related services and supports also must be medically appropriate and documented in an individual's person-centered care plan. And housing-related supports and services must be the choice of the beneficiary, who can opt out of receiving them at any time. CMS also recognizes that partnerships with state and local housing agencies are essential to success in implementation of allowing housing-related services and supports under the Medicaid program. Medicaid can play an integral part of collaboration with state and local housing agencies in three main ways. First is in developing formal and informal agreements and working relationships with state and local housing and community development agencies to help beneficiaries access existing and new housing resources. We can also participate and contribute to the planning processes of state and local housing and community development agencies by collecting, like through beneficiary surveys or claims data, and providing demographic, housing needs, and other relevant data for Medicaid eligible populations. And finally, we can help coordinate with available housing locator systems or listings and developing or coordinating data tracking systems to include information on the availability of affordable and accessible housing. CMS has also been forging policy avenues to support states with developing and strengthening partnership opportunities between health and housing systems. Under the Money Follows the Person, or MFP demonstration, CMS recently expanded the scope and definition of MFP's supplemental services. Effective January 1 of 2022, the definition of supplemental services was modified from one-time services to short-term services to support an MFP participant's transition that are otherwise not allowable under the Medicaid program. The expanded definition of supplemental services includes 100% grant fund coverage of short-term rental assistance up to 6 months. States must have a partnership with a state or local housing agency to administer this short-term housing assistance. CMS anticipates that this provision will help to advance and strengthen health and housing partnerships. We also have Section 9817 of the American Rescue Plan Act of 2021, under which states are expanding and enhancing access to HCBS by using ARP funding to implement activities to develop and strengthen partnerships with state and local housing agencies to assist individuals receiving HCBS to gain access to non-Medicaid funded housing. And finally, you heard me reference a minute ago 1115 demonstrations. Under that authority, CMS has established a new framework in which to evaluate state proposals to address health-related social needs. Key to this framework is a required component that states must have partnerships with other state and local housing entities to assist beneficiaries in obtaining non-Medicaid funded housing. That is just a snapshot of what CMS has been doing to move the ball in this combination of health services and housing supports. I'm so happy to have CMS represented with you here today. I'm going to turn it over to my colleague Richard in our Housing and Urban Development to pick things up from the housing resources perspective. Richard.
Thank you so much, Melissa, and to Lori, and to all of you for joining this important webinar. You know, among the many ways that HUD is looking to advance our mission to increase affordable housing and to create strong, sustainable, and inclusive communities is the work we're doing to meet the housing needs of people with disabilities, older adults, and certainly people who are experiencing homelessness. And, you know, we have a variety of tools to address the housing side of that equation, but we also know that for many people who are experiencing homelessness, who are leaving institutional settings and entering the community, or who are aging and wish to age in place, that it's the combination of housing and services that is the key to their success in having a stable home, but also to meet all of their life goals. And we know that HUD cannot achieve that part of our mission alone. We need to do that in partnership with HHS. So we are particularly proud at HUD to be a part of this Housing and Services Resource Center that Lori Gerhard mentioned that we've stood up. And today's webinar is just one of the many ways that we're trying to provide more information to communities on how to link our programs at HUD with the many opportunities at HHS to provide supportive services. This is a particularly exciting time to link housing and services for the populations we're discussing. You heard from Melissa some of the opportunities within CMS through the Money Follows the Person program and the changes they've made to supplemental services, as well as the growing number of states that are using 1115 waivers to cover some of the supports and services that can help people obtain and maintain housing. On the HUD side of that equation, we have put out pretty significant resources in the last 2 years to meet the housing needs, particularly those for people who have disabilities, as well as for people experiencing homelessness. Through the American Rescue Plan, we issued close to 70,000 emergency housing vouchers, over 60% of which are now leased, but which are intended to serve people who are experiencing or at risk of homelessness, including people who are exiting institutional settings and who are at risk of homelessness. We also have awarded additional mainstream vouchers, which are known as our Section 811 vouchers. These are rental assistance vouchers that are intended to serve people with disabilities, and with a greater focus on those that are leaving institutional settings or exiting or transitioning from homelessness. And then, of course, we have other programs known as the Section 811 program and our Section 202 program that specifically provide affordable housing opportunities to people who are have disabilities or older adults. And all of those programs are kind of targeted specifically to the populations that are the focus of the Housing and Services Resource Center. But many of other HUD's other programs, including our regular housing choice vouchers, can and should serve people who are exiting institutional settings or exiting and transitioning from homelessness. HUD has provided a number of, in addition to providing more resources, we've also been providing additional guidance and tools that can help communities to use vouchers. I know one of the greatest challenges to using rental assistance, tenant-based rental assistance to help people to obtain housing is actually finding available housing on the private market, or landlords who are willing to rent. And so HUD has actually provided additional tools on how communities can engage landlords and recruit them to participate in the voucher program. And you'll hear in a little bit from my colleague, Nick Bilka, who has helped to develop some new tools that public housing agencies can use to really engage and recruit more landlords to participate in the voucher program. In addition, HUD has also issued guidance around uses of administrative fees to the roughly 3,000 or so public housing authorities, many of whom administer voucher programs. They all receive administrative fees that kind of come along with those voucher programs. And HUD has issued guidance on clarifying the many uses of administrative fees, including to cover things like housing search and landlord recruitment, to cover landlord incentives, as well as to pay for things like security deposits or move-in assistance. And so many of the kind of tools and opportunities that communities have through the Medicaid Money Follows the Person program, supplemental services, are similar to those that can also be covered through HUD's voucher administrative fees. And so again, I want to reiterate, there are many more tools than ever to be able to really provide the kind of glue and connective tissue that enables you to pair housing resources with supportive services. But I would say the most important connective tissue or glue to making housing and services work together are the people who are doing this work day to day. Many of you who are joining us today, who spend all of your work collaborating across sector, whether you're on the healthcare side or you're on the housing side and you're reaching across that sector to your colleagues, really building those partnerships, because it's through that collaboration and that collaborative thinking that you can help problem solve and really take advantage of all the opportunities, resources, and tools that are available to connect housing and services. So I'm excited again to welcome you to this webinar and to have you hear from one really exciting community example, as well as to hear more about HUD's resources. Back to you.
Thank you. Thank you so much, Richard and Melissa. This was a great overview. And now it is my distinct pleasure to introduce you to Ms. Whitney Joy Howard and Ms. Pam Parr, who are going to share information about their partnership where they're braiding resources in the state of Washington to provide access to rental assistance and supportive services and really create housing stability. And Ms. Whitney Joy will lead, who is the lead supportive housing manager for the Washington State Department of Social and Health Services, and Ms. Pam Parr is the executive director of the Spokane Housing Authority. I'll hand the presentation over to Ms. Whitney Joy.
Thank you. Hi, all. Whitney Joy Howard. I'm going to quickly go through some slides with some more high-level information to give a baseline understanding, and then we'll open to questions and let you all guide the conversation to make sure you're getting the information and the level of detail that would be most helpful for you. Next slide. In Washington, the bulk of Home and Community Services Division, or HCS, highest acuity clients are served in-home. There is some belief out there that people with high needs require 24-hour care. In reality, in-home care offers flexibilities not found in other settings and often provide a more stable option while supporting individual choice. The Money Follows the Person demonstration gave HCS the opportunity to create a statewide housing team. Among other things, the housing team acts as liaisons between our long-term care case managers, various housing-related contractors, and community providers, and available long-term services and supports. I like to think of the housing team as the bridge and the translators between the worlds of long-term care and affordable housing. Next slide. Providing housing resource opportunities to individuals via the home and community-based service delivery system gives us the flexibility to combine a housing subsidy with physical housing, actual units, actual apartments, and then layer in a variety of services, including transition assistance, in-home and supportive housing services. This integration creates a support structure or the stability for our participants, which helps them maintain both housing and service connection. There's a rich discussion to be had here around how to acquire and actually braid these resources together to holistically support an individual. Our team's always happy to talk with others about this work. So if you're interested in a more involved conversation than we have time for today, please just reach out. That's a perfect example of creating partnerships, putting them in action. I do want to flag that the aim is to do the patchworking or the braiding on the back end as much as possible. So the user experience is streamlined and not administratively burdensome. It's user friendly, and hopefully this process is also continuously user informed. This slide is also a visualization of the resources we have to support our partnerships. As Washington's long-term care system, we can have conversations with public housing authorities or other housing-only entities and discuss our array of in-home services, which aid a participant's tenancy. We have transition assistance included in our participants' in-home benefits package. So funds for move-in assistance, setting up a home, funds to sustain tenancy or prevent homelessness, things like pest eradication, which could be used for costly treatment of bed bugs to save a tenancy, or emergency rental assistance. We also have our statewide housing team of program managers to act as a point of contact for these housing entities if things need to get escalated. So when you think of building partnerships to support your ability to braid the housing and subsidy, you need to map out what you bring to the table as you're looking to partner with other entities to create those wraparound supports for housing sustainability. Next slide. Our housing team has a position dedicated to building housing capacity for HCS clients. This position leans on existing partnerships and works to develop new opportunities through engaging some of the entities listed on this slide. Our housing capacity partnerships braid services and funding through HCS with housing units via set-asides from developers, nonprofits, property management companies. So basically, we as HCS are providing rental dollars and in-home services, and what we're getting is access to units within new or existing apartment buildings. The set-aside approach is a hybrid of project and tenant-based subsidy models. So we're providing immediate access to housing while honoring principles of housing choice. Next. In 2012, HCS launched a state-funded ALTSA subsidy as part of our Money Follows the Person demonstration. As the program grew and our legislature approved state funding to expand our subsidy, in 2016, we issued a request for proposal for a single entity to take on the centralized administration for our subsidy. In Q&A, if people want to hear, Liz Prince can speak more to the nitty-gritty, but basically we knew subsidy administration was bread and butter for public housing authorities. And there's a statewide meeting where all the public housing authorities attend, and Liz was able to get on the agenda and spoke about this kind of radical idea. And we put out our RFP, and Spokane Housing Authority stepped up and they ended up contracting with us. That initial contract was for 2 years at $130,000. And our current contract is for 3 years at $8 million. Wrapped into our contract for the subsidy dollars is an administrative fee, which enables Spokane Housing Authority to retain staff needed to support the program and have them specialized in this work. This partnership has given us access to housing authority knowledge on how to administer the subsidy, and together we've created effective policies with the flexibilities that state funds allow to have enabled our subsidies growth. And now I'll turn it over to Pam Parr to speak from Spokane's perspective on this partnership.
Hello, everybody, and thanks for having me. I want to say first, Liz Prince, who you'll meet in a little while, can talk me into just about any crazy idea. Let's start there. I think we both enter the work with the spirit of innovation, collaboration, and flexibility. Braiding together funding and programming is really interesting. The Housing Authority actually put together a program just in our jurisdiction at one point to connect services and housing. We had voucher holders who were having a really hard time finding a place to live, even if they had a voucher. And we knew that services was the key. So having somebody to actually help get a landlord to yes, identify a unit, help them move in. So we created a local preference program here that partnered our voucher assistance with local service providers, including aging and long-term care. And this has allowed us to change our success rate from about 37% to about 80%. Just pairing those services with that voucher absolutely results in better outcomes for the client. Whitney gives me a hard time because I have this philosophy that I would rather ask for forgiveness than permission. And I really want you to think about that, because housing authorities in collaboration with HUD have great amount of flexibilities to create these local preferences that address local community need. If your housing authority is not at the table, one, they should be, and two, they can be creative and still follow the rules within HUD's structure and system. Housing authorities now can provide landlord incentives. I know I saw a comment in the chat box that was one of the issues. And we can provide local incentives now using those administrative fee flexibilities. And so I think there's lots on the horizon that will push us forward. Next slide.
Okay, so we want to make sure we have time for questions. Again, let you guys guide the conversation. So we did just include here, kind of as a wrap-up slide, some concrete strategies that we've developed to support our program. I do just want to quickly call out, we do Spokane Housing Authority and Washington's Home and Community Services housing team have dedicated staff for this partnership. So that first bullet there around timely voucher issuance, we're currently hovering about, from the time a subsidy application is submitted to Spokane Housing Authority, around 1.5 days for that subsidy to actually be issued to the client, which is pretty remarkable. The other thing I want to call out is training. You can never, ever train enough. It's an endless loop. There's a lot of turnover within this field. We've built up people learn differently. We've built up a bunch of different formats to provide trainings. We built up a website, created a lot of different materials. So just be really mindful of training, and training some more. And with that, let's open it up to questions.
Thank you so much, Whitney, Joy, and Pam, for that presentation. And we're joined now by Ms. Elizabeth Prince and Ms. Johnny Matson from Washington's Department of Social and Health Services under the Aging and Long-Term Services Support Administration. And Ms. Prince is the Project Director for Roads to Community Living and Housing Unit Manager, and Ms. Matson is a Housing Program Manager. And so we do have a couple of questions that have come in. First, can you talk a little bit about your success rate? I think, Pam, you called that out. Like, how did you all go from, I think it was 30% to 70 or 80% success rate? Can you tell us more about that?
Yeah, and I'm actually talking about a program that we have called the Referral Voucher Program, which is a partnership that we have with Aging and Long-Term Care and about 15 other local supportive services agency. And so the success rate there is 87%. I would guess that the success rate in the Bridges program, which is the other program we're talking about, is actually higher than that. I don't have it off the top of my head, but I would guess it's in the 90s.
Yes, we do have a really high success rate of once a voucher is issued. We also have flexibilities built in, like we can extend a search time. A lot of vouchers have maybe a 90-day or 180 day limit. For us, we'll let a client search up to a year if needed, especially if they have certain accessibility issues or live in a certain part of the state where finding an affordable unit is more challenging. So, we work with the client till the end of the earth to make sure that they are able to lease up. And I think one of the main things that supports that is either using a supportive housing provider through FCS or through our state GOSH program, or what we call a community choice guide, which is a person that's specifically dedicated and trained on housing. Their number one job is to find apartments for people. So our clients get attached to one of these providers, and as a pair, they go out and search for the housing and find it.
I would add that the Housing Authority actually has full-time staff that is dedicated only to helping people secure units as well. We have a full-time in-house landlord liaison that assists people as well.
The only thing I'd add is, as whenever you can get people to specialize, it's a great thing to do because it really helps move that process along. This is really complicated stuff often, and it's very hard when you ask people to look at a whole bunch of different programs and services and figure out how to make it work.
That's terrific. Well, can you tell us something about how the partnership began, who you reached out to, and how you've been leveraging funds?
Sure. Do you want me to start, Liz, and you can dive in? So the state of Washington housing authorities, there's 37, have an Association of Washington Housing Authorities. And when this first started, I was actually the president of the Association of Washington Housing Authorities. And Liz came to me with this wild idea about providing state-based rental assistance paired with services. And she asked all 37 housing authorities if they would be willing to partner and pilot this $130,000 program. And I was the only one that said, yeah, I think this is a good idea. Let's try it. Out of 37. And because the need is statewide, what I did is said, oh, well, we can do this. So I approached every other housing authority in the state, and I executed interlocal agreements with each and every one of them that allows us to operate this program in their jurisdiction. The aging and long-term care folks actually gather all of the information and hand it to us on a silver platter, which is amazing because that's how we get to that 1.5 day processing time. And then we contract with those local housing authorities to do housing quality standards inspections locally. So all the paperwork runs through our office in Spokane, but the inspections are done by the local housing authority.
The only thing I'd tell you is a little bit of backstory, which is when we first started through rebalancing funds to do some subsidies for some of our folks in the Money Follows the Person program, we started out by having to contract with every individual landlord in order to get that money to them. And I would tell you within a few months, the whole team was up in arms saying, we can't do this. It will not work. And that's when I came over to, I talked to Pam first and then went to that meeting. And really, we were so open to different, regional, whoever would step up. And thank goodness, Pam was right there. And I will tell you, having a statewide way to do this is really ideal because it does go towards what Whitney Joy talked about, trying to create that seamless interface for clients. It just makes things flow.
It really streamlines the process, having to only deal with us.
Absolutely.
I just want to call out that part of what is not being said is you have these two amazing people here who are kind of willing to just go for it and think outside the box and have that the personality to kind of be bold and experiment and, not ask first, right? So I think that that's an important piece of this as well. You have to have the right people in the right places at the right time.
people make all the difference in the world. And also just taking the expertise from both of these sectors and bringing it together really creates such a great opportunity for people that live in Washington State. And so we commend you all on that. Can you talk too about any formalized agreements that you have in place in order to support this initiative?
Sure, we have a contract to provide these services for aging and long-term care. The other thing I would say is that we actually took all of the HUD voucher forms, me, took all of the HUD voucher forms and created new forms specifically for this program that were modeled after the HUD forms. So that the programs and the rules basically work the same way around what we're gathering and what we're keeping track of. We aligned it with the voucher program to simplify it for staff. So we just took the voucher forms and we created new forms specifically for this program.
What's really great is every time, through the years, as we develop a new efficiency or a new idea or a new flexibility, we have the control here at the state to say, you know what, let's update this form. Let's do this a little bit different. Let's make this a bit easier, either for landlords or for Spokane or for us or, the client. And we can do that. We can revamp our forms. We always have discussions with Spokane to we want to make this change. Are there any unforeseen complications that you can think of? We partner in making these decisions, but then we just, we enact them and we make it, that's how we move from here forward. Our team holds a policy document, if you will, where we have our own set of policies and procedures to administer this subsidy, because we want to make sure that we're consistent with everyone, that everyone is treated fairly, treated the same, much in the same idea of how HUD goes about things, and so it's really great because we can carry that sort of, culture and idea forward into, improving the subsidy as the years go by.
Yeah, I mean, one of the things that we're trying with a new tax credit project is we're going to look at maybe project basing a few of these so that it has direct access to the units. And we created new forms for that too.
That's terrific. I think when we were prepping for the call, we were really impressed too about how you're really leveraging the expertise of both sectors or organizations, and with helping people get placed in a home that might not even be a qualified property, and then helping that property become qualified. Can you speak a little bit around how you all leverage those areas of expertise?
Wow.
Well, we do, Pam, the Spokane Housing Authority contracts with individual housing authorities to do those inspections. So we do make sure that we're sticking with, that quality framework before we will pay our subsidy to a particular landlord, and that winds up being important, just to be able to make sure that our dollars are going towards kind of sustainable ways. And the only other thing I'd say about that is, if you are in a fortunate enough position to kind of have this kind of flexibility, you do have to be mindful of balancing, staying with the HUD guidelines, which are going to be, when people move on to a federal subsidy, which is our goal, they need to be able to sustain their new subsidy with those federal rules attached and the dollar limits and all of that. So, we can make some changes at the state paid subsidy level, but you do have to kind of do that dance of making sure you don't change it so much that it's not going to be sustainable.
Thanks. That was really helpful. I think the other question we had is how do you maintain the relationship? What is your regular cooperation as partners? Do you meet regularly? Can you tell us a little bit more about how that works?
We email about 100 times a day, I think. But we do also have regular meetings. Johnny, you can speak to that.
Yeah, like we spoke about earlier, each of our team does have dedicated staff. So that really kind of cuts down on who needs to communicate with who, and also helps, corral the training. We know who we need to advise and tell about changes. And we've also, both of our teams have some really long-term staff, which has been really helpful. I know the original person at Spokane is still with the team. Whitney, Joy, and I have had really long tenure on our housing team. So that has been helpful as well, is to be able to retain, the staff and the sort of historical knowledge, right? But yes, we email. Spokane has a centralized email, which is wonderful. So no matter who's working on vacation, what have you, someone is answering our emails all the time, Monday through Friday. So that is a very helpful thing. And yes, almost all of our communication is by email. We send attached documents, obviously, PDFs and whatnot. And then it's also email communication with landlords as well. So really the main communication is between us, between the housing authority, between our contracted provider that's supporting the client leasing up, and then with the landlord. So we've got 4 really important entities that are working together to get people housed. And then not even to mention our home and community services case managers, which are the ones that are actually authorizing the services to make a lot of this happen. So it's a ton of communication, and it's something that I think we strive to work towards improving constantly, as far as looping everyone in, but also not, being on every single email, right? So there's a balance there, but we also do meet in person. COVID disrupted that a bit, but we do, meet in person, the Spokane Housing Authority team and our team. I think we're looking at increasing that, because as our client base grows, the more important it is, that our relationship with them is watertight. So yeah, we do some Zoom type meetings, but we actually put the travel time in to actually meet in person as well.
I'll just quickly add one last thing for individuals thinking about maybe trying to replicate this. We are looking now, thinking future forward, of trying to find ways to better integrate into an online platform to kind of minimize some of that email communication that gets pretty overwhelming. So if there's possibilities to have some kind of online platform in your community to be able to have some integration there, that would be a great thing to pursue.
That's terrific. Thank you all so much. Thanks for your leadership in Washington State. And we'll bring you back for the Q&A session. So now we're going to shift gears a little bit. I'd like to introduce Mr. Nicholas Bilka. He is the Housing Vouchers Program Director at the U.S. Department of Housing and Urban Development, or HUD. Mr. Bilka will share technical assistance resources that states and community agencies can use to increase landlord recruitment and retention. Over to you, Nick.
Okay, thanks so much. I've been reading the chat and the Q&A, and I am impressed and overwhelmed by the number of questions that have come in. I like to say you can reach out to me at landlordtaskforce@hud.gov, and I'd be happy to try to answer some of those questions that I haven't been able to answer today. Could we go to the next slide, or do I have control of that? Okay, I'm going to talk today about some of the landlord resources we've put together over the last few years. As I'm sure you're aware, housing choice vouchers are a big tool to reduce homelessness and provide economic opportunities. This has been demonstrated by empirical research and stories of countless families across the country. While a voucher can offer hope and the promise of greater opportunity, that opportunity can't be unlocked without a willing houser willing to accept the voucher. Given the shortage of housing in many areas of the country, voucher holders have faced a more challenging landscape in recent years. In response to this and administrative data that we have and a growing body of research, HUD started to take steps to reach out to landlords. And this was pre-pandemic. And we know during the pandemic, the housing market got really weird in a lot of places. People moved places. The rent increases of the last year have been very extreme. So we've been working on providing resources to help PHAs reach out to landlords, have better relationships, and get them involved with the program. we've incorporated the lessons we've learned into new programs like the Emergency Housing Voucher Program, where we have a $3,500 fee that can go to participants to use on things like landlord mitigation funds, security utility deposits, incentive payments, etc. One thing we have is a landlord strategies guidebook. And this guidebook provides information on recruitment, retention, responsiveness strategies, and how to minimize bureaucracy. We also include some of the administrative flexibility that HUD has provided. I think that I see a question about the link to the guidebook. I believe there'll be a series of links going out, but correct me if I'm wrong, anyone in the chat. So we'll have a link to all these resources that get sent out to you, and I hope you'll find it very useful. We've also, as Richard alluded to, put out a notice on the use of admin fees this year that shows some of the flexibilities that PHAs can use to try to recruit landlords. We've also given more money for mainstream leasing so that PHAs can use $500 per voucher if they're accepted to use on things like security deposits. I know application fees was mentioned. That is eligible under PIH notice 2218. So there'll be a lot of links going out on that. Could we go to the next slide, please? And so there's a lot of resources, things local governments and stakeholders can do is help bring PHAs together with landlords and things like landlord symposiums. Damage mitigation funds are something that we've seen some states, particularly in the West, use. I think Utah and Oregon do these, and it's a little less costly than security deposits because you only have to pay when there's damage to the unit. Landlord incentives, providing grants so that one-time payments to landlords to participate in the program, and funding landlord liaisons. In addition to this, what is also useful is housing navigation and help with that process, because with all the changes in the housing market in the last year or the last few years, technology, the different websites and stuff, it can be overwhelming for people participating in the program and dealing with all the paperwork that HUD has and the PHA has. So anything you can do on that front is helpful as well. Next slide, please. And here we have a bunch of links to landlord resources. I would point out the first two. There's stuff in Spanish and English, myth busting, testimonials from landlords, etc. I think we have other information as well on PHA's role in the program, different research studies we've done, etc. We know it's a challenge with the administrative fees that are currently out there for landlords to do this, which is why we've tried to give these extra funds for mainstream and with the new vouchers and the EHV we've awarded this year. And we'll continue to try to get more resources to help PHAs be successful. We look forward to continuing the dialogue. Again, send questions, suggestions to landlordtaskforce@hud.gov. I have a lot more information I'd be happy to share with you, but I know we're limited on time. I appreciate all you're doing, and thank you for having me today.
Well, thank you so much, Nick, and we'll move on to the next slide. And now back to you, the audience. We would like to know what support we can provide at the Housing and Services Resource Center to help you develop and enhance these statewide and community partnerships where you live and work. Using the chat, please respond to this question. What technical assistance resources or activities could the Housing and Services Resource Center, HSRC, create to help support the formation of rental assistance and supportive service partnerships in your state, community, or region? We'll be watching and reading the responses that we get through the chat after the webinar. Now we're going to welcome back all of our presenters for a lively discussion and some Q&A. If you haven't already, please submit your questions in the Q&A tab in the Zoom platform. Now we'll go to our presenters and start with some of the questions. And thank you so much for all the questions you've been adding as we've been going through the session. And maybe we can go ahead and start with Washington State. Were landlord incentives a part of the discussion when you began developing your partnership?
I would say not initially. I think that HUD's emergency housing voucher program has provided some tools that we see can be really effective. And so it might be part of more discussion in the future. Also, Spokane Housing Authority is one of the most recent public housing authorities to be designated as a moving to work agency, and we are a part of a landlord incentives cohort. And so we're going to be testing some new things.
I'd add just, making sure that people know the services that we also offer are a big incentive, as are kind of the subsidies and a kind of way to braid those subsidies. So not that I can think of, unless I'm forgetting something.
We do.
We also, I was going to say, we also do, partner with Washington State Department of Commerce, and they have a variety of housing programs that our landlords have access to because they do accept subsidies. One of those is called the Landlord Mitigation Program, which offers different types of financial incentives for clients to accept and rent to people who are using vouchers. So we do our best to educate our providers when working with landlords and landlords directly that program exists.
I was just going to add, prior to the landlord mitigation program, we have those transition assistance funds that we are able to do things like double deposits to help support landlords, agreeing to rent to clients. So that was kind of a landlord incentive program without being an official program.
Thank you all so much for that response. Nick, the next question goes to you. Are there ways that social service agencies can provide support to housing agencies to streamline the voucher leasing processes?
Well, appreciate the question. I think the way social service agencies can help is helping with the housing search and filling out these forms and trying to keep them on task to make sure that these things get completed, because there is a bureaucracy to the program, and the faster you can move those things along, the less bottlenecks there are. And helping with housing search can be such a huge thing now in a lot of tight housing markets across the country.
I would also say that helping with the upfront paperwork is super important. It's a lot, and sometimes people struggle to get through it because there's very specific requirements about what PHAs should gather. So helping with paperwork and verifications of income, etc.
Thank you all. That's great responses. Richard or Martha, can you tell us a bit more about why state and community collaborations like this are so important?
Sure. I mean, from HUD's perspective, the public housing authorities that you heard from here, Spokane, and the other housing providers that we work with, they can't meet supportive service needs on their own. They really are. Their primary job is to meet the housing needs, and so relying on partnerships with particularly state agencies who have the bird's eye view on the different resources that can provide supportive services is really, really key. I'd say that it's really starts at the state level, but it's not exclusively at the state level where we need to see these strong agency partnerships. Public housing authorities, there are several that work at the state level, but most of them work at a regional level or at a local level. And so it's really important to really understand how the housing landscape is organized in your community and state, and to know who the various partners are. I would say on the health and services side, you want to find your state housing finance agency, your public housing authorities, which may be several in your region, as well as your homeless continuums of care. Those are really the key entities that you want to forge a partnership with to really look at the full scope of housing resources, because there's not, unfortunately, at the state level, one single agency that administers all the housing resources.
Thank you, Richard. And Martha, was there anything you wanted to add?
Yeah, sure. And I'll just add to what Melissa said earlier from CMS. CMS has fully recognized that individuals with disabilities and older adults really need stable housing opportunities, affordable and accessible housing opportunities in order to access health coverage and to achieve their community living goals. So the partnership on the housing side is just integral to the success of any Medicaid program, who is serving and providing services and supports for individuals who want to live in the community, for older adults and people with disabilities. And, the Medicaid program just has multiple pathways that states can use to really provide the services and supports and to forge these partnerships, to strengthen the partnerships, sustain them, through different avenues under the Medicaid program, whether it's the MFP program, an 1115 demonstration, or under, even administrative functions of the Medicaid program. So just multiple opportunities that exist within the Medicaid program. And as Richard mentioned earlier too, there were, so many new opportunities on the housing side. So, really urging and encouraging folks to take advantage of these opportunities on both housing and services.
Thank you all. We want to, unfortunately, we're getting close on time here. We've got about 3 minutes left to wrap up, but we will respond to all the questions that we received in today's session. We want to offer a big thank you to our Washington Housing and Services partners for sharing with us their dynamic and evolving partnership. And thank you to Nick for providing us a glimpse of additional technical assistance resources that can be used to recruit and retain landlords. Today, all of us heard opportunities we can act on in the coming weeks. Before we close, I want to remind everyone that in the coming days, we'll post a recording of this webinar and the slides on the Housing and Services Resource Center website. You'll receive an email notice when they are available. In the meantime, keep using the HSRC, or Housing and Services Resource Center website, which staff is providing in the chat. You can even bookmark our What's New page, which we are constantly updating, and there's a lot of activities that continue to come out and announcements. Next slide. The HSRC team is very excited to feature a webinar on the importance of partnerships between housing and transportation. It's the first in a series of tools the HSRC is developing to bring these two important entities together. We are aiming to make this available to you in February. Then in March, watch for the first of a series of webinars on housing needs of people with intellectual and developmental disabilities. And in the spring, look for a webinar on partnerships with the homelessness services community through the continuums of care and partnership opportunities there. If you registered for today's webinar, we'll send notices to your email once we finalize the details on these webinars, and we encourage you to regularly visit HSRC at the https://acl.gov/HOUSINGANDSERVICES. Once on the site, click on What's New for more details and information. You can also sign up for ACL updates at acl.gov. Next slide. Now I'd like to ask each of you to please take 3 minutes to answer our short feedback form. The link is in the chat. There are just 5 questions, and your responses really help inform how we can continue to improve our webinars and make them effective. Next slide. The Housing and Services Resource Center, or HSRC, is your resource center. So please email us at hsrc@acl.hhs.gov about your technical assistance needs, website suggestions, and your own cross-sector partnerships. Next slide. Finally, we want to thank our colleagues at the U.S. Department of Housing and Urban Development, the Centers for Medicare and Medicaid Services, and the Administration for Community Living, along with our contractors, Mission Analytics, U.S. Aging, Alyssa Enders, our ASL interpreter, and Cara D., our CART specialist, for their roles in developing and producing today's webinar. We're especially grateful for everyone who joined us today. Thank you so much for your participation. It really makes the webinar, and have a good afternoon.